You must be Michael. So I'm feeling a little fixation right here. The spine, the cervical, the thoracic, or lumbar. And this.
There's no one like Dr. Bud.
We're gonna give it a little bit here. Let me just check. Oh yeah, that's the way I like it.
Wow.
Good morning. My name is Dr. Michael Budincich. I'm with the Budincich Chiropractic Clinic in Pasadena, California. And we're going to talk today about some problems with the feet, some common problems of the foot, such as plantar fasciitis. We're going to be talking about heel spurs, metatarsalgia, and some other conditions that affect people's daily foot pain that they come to see us on a regular basis. And so we're going to discuss these issues. The most common thing that we see is a condition called plantar fasciitis, which is a pain in the gristle bottom part of the foot. The foot from the side view, let's say that this is your heel bone, and this would be the ball of the foot. Well, there's a piece of gristle that stretches from here to here called the plantar fascia. And when you go flat-footed a lot in sandals, in flojos, and basically don't take care of your feet with a good arch support or a good shoe, a lot of people will start developing pain either here or on the tip of the heel. It'll be classically painful more in the morning. So when you get up in the morning and you go to the bathroom, let's say right out of bed, you'll have a sharp pain either in this part of your foot or on the heel. And that'll be an indication that it's starting to come on. And then that condition may worsen to the point where you're really limping in the morning. And then generally, after you've walked a few minutes, you may not feel it at all for hours during the day until you sit down and rest. Then you go get up from your chair after an hour of sitting, and then boom, you have the pain again after a period of rest. The reason why you'll have pain is because the body will try to heal it during the time that you're resting and there's no weight on it. And then as soon as you stand up and you stretch that, it will break the scar tissue and begin to hurt right where the injury is. So plantar fasciitis is a chronic overuse syndrome that people get from improper shoes, lack of orthotics, flat feet, being on your feet too much, climbing on ladders and standing on ladders for a while, which stretches the plantar fascia. And we see a lot of that in the office, and the cure for it is taping the foot initially to take some pain off. Home ice. We have people freeze water bottles full of water upright in the freezer with about an inch at the top open, and then we have them put the cap back on and use that as a rolling pin on the bottom of their foot. A golf ball also helps to massage your foot while you're sitting on the couch watching TV. And those are the simple kind of home care things that you could do for a mild case. Now, as it gets more and more worse, you may develop pain so bad that you find it difficult to work. You find it difficult to just get up in the morning and walk at all. This is when you're really going to need treatment, but you've also let it go too far. So treatments initially could be tape and ice and rest, but if you're not able to do all those things, you really need to get into a ready-made or custom orthotic device which will push up on the plantar fascia. So I have a model here, and we're going to see a foot right here come out. Could you hand me your right foot, please?
Yes, sir.
Okay. So this right here is the arch of the foot, and so the plantar fascia stretches from here up to here and attaches to these metatarsal bases here. So this gristle will get really tender right here when you first have it, in certain cases of plantar fasciitis, or it'll be tender right here, right on the tip of the heel. So this is the typical pain area, either the tip or in here. If you're an older person, let's say in your 40s, 50s, or 60s, it's likely that if you've had this problem off and on for a while, you may even be developing a little bone spur here, or even back here where the Achilles tendon attaches. This is the Achilles site, and this is all gristle and tendon here until you get to about where the muscle starts here. On the bottom of the foot, this is 100% gristle in this section. So gristle, it is not properly supplied by blood. It's a white fibrous tissue, and so when you injure it chronically, it takes a long time to heal because blood can't get directly into the tissue. It's sort of like each cell has to hand nutrients to the other cell, like a bucket brigade putting out a fire in the old days. It has to hand off nutrients from cell to cell, maybe through thousands of cell layers. So this is why this is such a chronic, long-standing condition. So we try to put tape around the foot to saddle it. We will have a orthotic device go on there, and I'm going to show you. We'll fit orthotics to a person, and you can see how the orthotic itself will push and hold that arch up while you're standing and putting weight on it. So this is almost a necessity when you have a chronic case. If you've just gotten something because you did something weekend warrior, sometimes you don't need an orthotic. You can get over that with just a simple treatment, ultrasound, taping, and so forth, a foot manual manipulation. But the orthotic comes in when you get a little bit older, or if you have a chronically, genetically flat foot. This is a fairly nice arch here, but every foot is different and needs to be analyzed individually by the doctor. So this is a simple ready-made orthotic, but we also fabricate with plaster an actual mold of your foot to make a custom product just for the patient that will last for 10 or 20 years at a time. So these products, these ready-made ones, frequently we get 5 years or more out of these. They're a little bit weaker, and but they can easily be changed. So this is a simple little functional orthotic that come in dozens and dozens of sizes that we have to custom fit for the patient. So plantar fasciitis is by far the number one thing. The other places where people hurt on the foot, could you plan me the other foot, please? Another common area of chronic pain is right here. This is called the head of the fifth metatarsal. This gets really sore after you've had some weekend warrior activities, maybe haven't had shoes that fit quite right, you're playing tennis or doing some kind of bouncing type sport, and it'll feel like a boil right here. You'll just barely touch on that, or maybe you'll roll your foot during a sport a little bit, but you won't really sprain your ankle, but it'll roll over on this bone, and then the next day you can hardly walk, and it really, really hurts right here. Sometimes this bone and its articulation here will really, really get sore. This can also chronically break. You can break it with a stress fracture. You can roll it like I did once and actually snap the end of the bone off when I rolled it playing tennis. And this area will typically be very, very tender. This also responds to tape. It responds to orthotics and responds to rest. This needs to be x-rayed typically, because if it is something that came on over time, it could actually cause a stress fracture, which is visible on an x-ray. So base of the fifth metatarsal, metatarsalgia. The other common thing that we see is pain that you will get numbness and tingling on these last 2 to 3 toes of the outer foot. And this would be neuralgia caused by either a Morton's neuroma, or from the foot being flat too much and being in tight shoes, and it'll squeeze a nerve going between the toes, between the knuckles of the toes. So that will be characterized by sharp pain going into this finger or this finger typically, sometimes this one. And the place where a Morton's neuroma forms is generally between the third and fourth metatarsal. So that is a condition that can be helped with an orthotic as well, because the foot also has an arch that goes this way. So there's an arch that goes this way, as well as this arch that we showed you earlier. So a Morton's neuroma, even if you have it, if you have something pushing here, will make an arch, and it'll spread the knuckles apart, and that will give relief from the radiating pain that goes into the last 3 toes. So that's also something that can be cured without surgery, but if it gets really, really bad, sometimes we have to send you to a podiatrist to actually have that Morton's neuroma removed. But typically, if you're wearing the right type of footwear and the right orthotics, that can be relieved naturally without having to go the surgical route. So by far, the plantar fascia, heel spurs on both the Achilles and the bottom of the foot, the base of the fifth metatarsal sore, and of course the Morton's neuralgia and neuroma, those are some of the most common things that we see in the treatment of the foot. Thank you very much.